In today's episode, we're thrilled to speak with Dr. Aileen Alexander, a remarkable lifestyle medicine physician whose innovative approach bridges the gap between traditional healthcare and holistic wellness. Ever wondered why modern medicine often feels like a quick fix rather than a long-term solution? Dr. Aileen shares her inspiring journey from the constraints of the NHS, which is the National Health Service in the UK, to becoming an advocate for sustainable, meaningful health changes. Get ready to uncover the secrets of a nourished life. Welcome back to Wellness as a Way of Life, the less is more source of wellness, knowledge, wisdom, and inspiration for modern women and female founders. Here, we teach you why not all wellness trends are for you, how to figure out which ones are, and how to best adapt them for your personal wellness toolbox. I'm your host, Megan Swan, with more than a decade of experience in the wellness industry and on my own personal journey. I will teach you how to tune into and trust your intuition and drown out all the noise. I love to support female founders in the process of building their business to strategically optimize their physical, mental, emotional, and spiritual wellness. I have helped hundreds of women establish wellness as a way of life with my less is more approach. Join me on my mission to make wellness a way of life. Let's dive in. Aileen, I'm so excited for this conversation to have you here. Please tell us, how are you first today?
Oh, I'm so excited to be here as well. Yeah, I'm doing really well. Thank you so much. And how are you?
I'm well. Yeah, it's kind of a cloudy day, which is nice here in the tropics to have some break from the sun, and it, makes it easier to be inside and work. So I would love to talk to you about your journey from from being a medical doctor, which you still are, but you're not working in a medical setting per se anymore. Can you walk us through that journey, that decision-making process that you had? What were some of the catalysts to you becoming a coach like you are tonight?
Love that. Thank you for that question. Yeah, and there's so many like nuances and challenges around the nomenclature and like how do you label what I do now? Because whilst I am a coach, I'm kind of somewhere between a traditional medical doctor and a coach. I kind of sit somewhere in the middle. So I'm technically called a lifestyle medicine physician. And the reason that I decided to move away from, I'm going to call it traditional healthcare in inverted commas, is it was a few different things. I mean, partly because over here in the UK, yes, I'm from Scotland. This is my very toned down accent, which I'm sure sounds really strong to some of the people across the pond. We have something called the National Health Service. And in the National Health Service, as a general practitioner or a family doctor, you only get 10 minutes with your patient.
Mm.
And what the patients do in order to try and help you is they save their problems up and they come with this big list of things, which isn't actually very helpful. And then I always felt like I was doing people a disservice because I didn't have the time to give to them that they truly wanted and needed. But then also a lot of the culture is around medication. So if there's a sleep problem, there's medication. If there's mood disturbance, there's a medication. If there's anxiety, there's a medication. If it's menopause, there's a medication. And whilst I do believe that medications are necessary and needed in certain circumstances, they're not always needed. And they're not the only approach in order to support people. So I'm really interested in the way we live our lives and how that can create or lead to lifestyle related medical conditions like high blood pressure or type 2 diabetes or high cholesterol, heart disease, the list goes on. So what can we do to prevent these things from happening in the first place? What can we do to manage them without medications? What can we do to maybe wean off and come off medications? So in my work, I still do blood testing, I still review bloods, I still discuss medications with people, but not in the same traditional setting as I did as a medical doctor in the NHS, but more helping them to take a holistic view. And I had to leave the health service because I didn't get to do that in my 10-minute appointments.
Yeah.
So it was super tricky.
So there's a lot of similarities, I think, mostly with the Canadian scenario, but I do have a lot of clients in the US that also feel like they're given a very short window there's not a lot of opportunity, well, both on the patient and doctor side, like there's not enough time to really get to the roots of the issue. And certainly to help someone, change their habits or give them any sort of guidance on what it looks like to make better decisions. So I completely understand. And, we could maybe go more into that. I'd be curious, where did you feel like the pressure was coming from other than the time constraints? The quick fix of the whole medical 2.0 is big pharma, right? And I'd love your opinion on a couple of the, newer, very popular big pharma solutions to weight loss. But first, I love that your brand is called Nourish. Nourish is one of the 6 pillars of wellness that I operate with. And what does it mean to you, nourish, opposed to using like a different word that, talks about what we eat or food? And does nourish for you go beyond what we're eating and drinking?
Yeah, this is such a good question. The word or the phrase nourish came organically after I performed my TEDx talk. So my company wasn't always called Nourish, but we rebranded following the TEDx talk, which taught me really how to story tell and how to figure out what was it that I was really doing. Because it's really difficult to succinctly explain to people what we do or the depth or the complexity to it. And when you say, does Nourish go beyond the food and the hydration status and things like that? Absolutely. Like it has to be this whole mind, body, soul experience. Like it has to become almost like this way of life that becomes so natural. It's like breathing. So a lot of the people that come to me specifically or primarily women, I do work with men, although my branding doesn't say so. There are lots of men that make their way through and I support them. They're typically women in their 40s and 50s who have dieted on and off their entire adult life. They're usually stressed at work, they're usually not sleeping very well, feeling relatively burnt out, lacking in confidence. And the concept of being able to nourish themselves isn't even something that their brain computes with because they think, well, I just need to lose weight. But they've recognized that the process to losing weight is so much more than calorie counting, but they can't quite put their finger on, well, what is it? So, this concept of self nourishment, self kindness, self compassion, eating food to nourish our bodies, really looking at, well, what do we need? Because sometimes food has become a tool or a form of self care in order to soothe or manage emotions. So, it goes like beyond the concept of just, well, let's eat more vegetables. You know what I mean?
Yeah, completely. So I'm curious in the food system, are you seeing, I mean, I'm sure it's not as drastic as in the American or Canadian food system, where there's this lack of connection, I guess, with where our food's coming from, and then this reliance, mostly out of convenience, on food products, let's say in air quotes, that are just not, I mean, they're not, they maybe have added nutrients, but they don't naturally have a lot of nutrients. And people really connecting with this idea of like feeling satiated physically has a lot to do with, are you eating enough nutrients?
Mm. Yeah, so there's two different parts there, isn't there? There's the part about like this ultra processed convenient food society that we live in. And I do think it's different in the US and Canada than it is over here. I've worked with a few people in the US and there are different nuances. But I think a lot of it isn't about education in terms of people like practically knowing what's more nourishing or less nourishing instead of using the phrase good and bad, which is usually what people say to me. It's more about how do they practically apply that to their life. Like just this morning on LinkedIn, I did a little video about how I'd been on Instagram and there were these people posting all these idealistic, sorry, recipes that the average day-to-day person, including myself, like does not have the time to shop around and buy all these bits and pieces or to prepare and cook all of those things. So I think it's about giving people approaches that they actually enjoy, that fits in with social norms, that they want to look forward to at the end of the day, and that's realistic in terms of time.
Yeah, I'd love, so let's go there a little bit because this is something I deal with a lot as well in terms of giving clients sort of permission on the one hand to not have to be a gourmet chef in order to prepare food. And on the other hand, really inviting them back into the kitchen because there's a lot of people that are for, out of habit for so many reasons have just gotten out of the habit of preparing their own food. And I feel like one sort of common excuse is this idea that it needs to be really complex to either be considered cooking or delicious. And I'm much more into like, no, let's just what sometimes I would consider cooking, for example, others might say, no, that's just food prep. And I'm like, if you're putting food on a plate and making it delicious, to me, that's, cooking. So are you seeing a lot of this, pushback in terms of time or creativity, or there's a lack of know-how in preparing food?
I tend not to see that, but if I was sitting here as an NHS GP, then yes. So the women that come to me because life is just so busy and they're not really sure where to start and often are making effort, but the effort isn't well founded. Maybe they've been following some myths or misconceptions, and it's about really bringing it back to basics. And I hear that bit as well about giving people permission to not have to be that gourmet chef. Like, absolutely. But we also want food to be tasty. So often what I see is people will revert to like the whole chicken, broccoli, and rice approach in order to cut their calories and whatever else and be really restrictive. And actually, what I want them to do is to add some more of this stuff that maybe isn't considered the most healthy or optimal food, but something that they really enjoy, and adding these things back into the diet, but also teaching them how to socialize, or maybe they want to have a takeaway, or I don't know what you call them over in this in the US, a drive through, whatever, I don't know. But being able to have these things now and again in moderation, rather than saying, I can't have that ever again because it's bad and it's not allowed and I've failed if I've done so, because that creates all sorts of negative spirals and mindsets.
Yeah, and I think we're exactly on the same page there in terms of it not therefore being sustainable, and we're all about creating sustainable change. So what are how, because for me part of this is teaching women in particular again to enjoy eating, like that it should be like naturally it's this thing we enjoy, and there's just been so much brought into our society and our awareness and our socializing, particularly as women, in this, it's just become this really negative. It's either we're rewarding ourselves and rationalizing that we deserve the reward, or we're quote unquote behaving ourselves and restricting ourselves in some way. And, it really needs to come back to just, eating because we love ourselves and want to feel nourished and satiated versus these, mechanisms of control, if you will.
Absolutely. So I always try to help people understand where the mechanisms of control came from. And more often than not, it's diet culture. But you and I both know you can't just say to people, well, you feel like this because of diet culture. Now let's move on. We have to use that real curious and compassionate questioning to help the individual to find that root cause within themselves, and then almost teach them to self coach so that they can work through these situations and scenarios. So, certain situations will pop up for people. For example, I had that chocolate bar and I felt really guilty. Okay, well, tell me about that. Why do you think that was? Has that happened before? What did it remind you of? Rather than, well, you shouldn't have the chocolate bar because it's bad food, or it was X calories, or whatever else. It's really helping people to like look within themselves and find the answers there. Because until we do that, we can hand out as much drugs as we like, but we're never going to prevent, reverse, or manage type 2 diabetes properly, because things will continue to escalate if we don't make those behavior and lifestyle changes. Before you know it, the person's on 4 medications, looking at possibly starting insulin. Maybe they've got some kidney problems as a result, or eye problems as a result, and then maybe starting to get associated medical conditions. So why the traditional medical model doesn't look at food, diet, exercise, stress, sleep is like, I just don't get it. It makes no sense to me. With that said, since I left my job as an NHS GP 5 years ago, it is changing. The narrative and the culture is changing. Doctors are more interested in these things. I've gone down a total rabbit hole here, haven't I? But the doctors that are interested in these things aren't getting the opportunity to practice it. And so they're starting to now leave the NHS too.
Yeah. So just quickly, are you seeing that in the UK, they're starting to talk about value-based medicine as well, like bringing a preventative perspective into how they're treating these things more so than the quick fix offering of big pharma?
So the individuals are, aka the doctors, but the system, aka the health service, to the best of my knowledge, isn't at this present time. And I think it's because it's on its knees. It's really struggling and crippled by the current demand. There's people that have cancer and aren't getting the right treatment for that. Like, we need to get that bit right before we can start looking at this part. And I know that if we look at preventive medicine, it will change the outcomes further down the line. It would be crazy to pull resources from like almost this critical care model in order to move into preventive medicine. Like, we need to start at the top and work down. But it's just such a crippled system. People are getting sicker, people are living longer, there's not the budget, there isn't the resources, or they're not being allocated correctly. It's super tough.
Yeah. I mean, it's this analogy of, your house is on fire. So you have to put out the fire first before you can do the sort of structural long-term shifts. But yeah, I mean, it's only going to get worse, which I'm sure you know. I would love for you to briefly, we don't need to name, drug names or anything, but what's your opinion? Are you seeing a lot of people that you're working with even considering going back to taking certain weight loss drugs just because it seems to have taken over the narrative?
Yeah, they have. They've taken over to the narrative to the point where people who have type 2 diabetes and were using these medications can't get them. You have to really think about the morality and the ethics behind that. So personally, I don't prescribe them. And personally or professionally, my professional standpoint would be that I'm not supportive of them because I don't think that they're necessary. I think there are other ways which we can manage weight long term, but it would be more quote unquote difficult in terms of it requires significant changes to lifestyle, not just food, but sleep, stress, habits, the whole shebang. With that said, we know from the research that these medications do help people lose weight and they do have positive outcomes in other parts of cardiovascular health, for example. So it isn't just weight loss that they're beneficial for, but we just don't know enough information, like, because we can't compare the lifestyle changes directly with the drug trials because we don't have the budget, because there's no drug company incentivized to fund lifestyle change. So it's like anything, isn't it? It's about looking at the bigger picture. And also, I think the other part is it's all good and well for someone to lose weight and be lighter, right? And to change some of their health outcomes. But do they feel good? Do they have confidence? Are they energized? Because there is this belief that when I lose weight, everything's going to get better. So people will come to me primarily, often for weight loss. And like, weight loss isn't really what I do. I do all the other stuff, and the weight loss is the outcome. So I'm really interested in like quality of life and longevity and all of these things. Like, because a lot of the people that are taking these medications, they're not changing their diet at all, you
Yeah,
know?
I
And
think,
that's where it becomes difficult.
yeah, I completely agree with you. And ultimately, as it currently stands, there's very little evidence that they can maintain those changes without the drug, which therefore, just your last point there, it is going to become very interesting in terms of, I've heard both male doctors, friends of mine, that took it more just to experiment and understand, like, what is the experience different. I mean, not going to get into whether I think that was a good idea or not, but they both observed that they had zero interest in drinking alcohol as well. So it really like has an effect of controlling your habits across the board. One could say cravings, addictions, these things. So I think it's going to be interesting how it overtakes, I think, continues to overtake the narrative.
Yeah. And what I've seen a lot as well is people will start on one and then they'll try a different one and then they'll try a different one. And there'll be people in, Facebook groups, for example, saying, I'm taking this one, what are you on just now? Oh, well, I prefer this one. Oh, I'm going to ask my doctor to give me that one. And I'm like, I don't think that's how medicine should be.
Yeah. So last question sort of around medicine, not that one. I'm curious, once you work with women, specifically, there tends to be, at least on this side of the pond, as you say, on this side of the pond, there's like a massive over prescription of anti-anxiety and antidepressants, be it, either for women that should probably be on things during perimenopause, more like hormone replacement therapy versus antidepressants, and just across the board, like not even that age group per se. Are you seeing that once they find this sort of more holistic approach, that it's like a secondary effect? You were saying, they assume their life's going to be perfect, they're going to be happy, like everything's going to be resolved with the weight loss, but you're doing all this other, sort of groundwork at the same time. So I'm guessing you have that secondary effect where they do feel better, but it's not necessarily about the weight.
Absolutely. Yes. And they're like, oh, I didn't think this would happen. Like, it's like, oh, wow. And I'm like, yeah, that was my goal for you from the beginning. I just never told you. So anybody that I see who's on any kind of antidepressant, anti-anxiety medication, or medications for like tension type headaches, migraines, stuff like that, my goal without me voicing it to them is always to reduce it or have them come off. And I don't even have to start the conversation. They often start it because ultimately the less medications that we have to take or we need, then the healthier we are. So 100%, of course, it is important that they lead with their own doctor and they wean off safely. But yeah, it is such a beautiful thing. I would say that these things are typically over prescribed, and like the guidelines are that we should feel well for at least 6 months before we come off any kind of antidepressant. But people just get lost to follow up, or when they go back they end up seeing a different doctor, so there isn't that relationship that's built. And there's often this fear for women of, well, I felt so bad then, I don't want to go back to that place. So it's about building up that inner resilience. But we also know that the foods that we eat, the exercise we do or we don't do, the way that we sleep have huge impacts on our mood. Like that has been scientifically proven. Like we can't argue with what the research says. So if we do those same things, then potentially we don't need some of these medications. And your other point around perimenopause and menopause, yeah, absolutely. So many of my patients have come to me and they've either been at one point on an antidepressant, which has been related to mood fluctuation around perimenopause or postmenopause, and they shouldn't have been on that medication. And I question, well, what caused that? Was it that the doctor wasn't confident enough in prescribing HRT? Was it that the doctor wanted to get the patient out of the room in less than 10 minutes? What was going on? Because HRT prescribing is an absolute minefield. Antidepressant prescribing isn't, and it's typically safer, or was considered to be safer back when there was all the kind of concerns around breast cancer risks and all that stuff before we had the research. So yeah, it's really, really, really tough. And most of these women have advocated for themselves and they said, look, no, I don't want to take this medication, but yet they've still been prescribed it. So what can we do, you and I collectively, and the rest of the people that are doing this wonderful work, to support people before they get to that point, so that that doesn't ever become a conversation that they need to have with their doctor?
Yes, beautiful. So lastly, I'd love to know, as an entrepreneur, what are some of your personal non-negotiables in terms of taking good care of yourself?
Oh my goodness, how long have you got? There's like a whole list of stuff that I do. And this is the way that I have learned to care for myself, because I am somebody who used to take antidepressants. I am somebody who used to take anti-anxiety medications. I am somebody that woke up in the middle of the night, stressed at my box, overthinking, da 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 da. I am somebody who used to binge eat for comfort. So I've lived a lot of the stories, or not even stories, a lot of the reality that my ladies have. So for me, sleep is always number one. Like it is the non-negotiable, because we don't rebalance hormones like leptin, ghrelin, hunger, satiety hormones. We don't repair our bodies. We don't manage stress well if we've not slept well. So that exercise as well is such a beautiful tool, whether it's just going out for a walk, or I actually really love heavy weightlifting. Like that's totally my thing, with some really loud metal music on in the background. Nobody would ever guess it. And then journaling. Journaling is a beautiful tool that I use in the morning just to get my head in the right headspace, because you use the word entrepreneur, and like being a business owner is tough. And I have a small team now, but in the early days when it was just me, it was really lonely. And even now that I have a team, it still can be, because you're constantly putting yourself out there, you're exposing yourself, and it doesn't always go the way you want it to. So using these tools in combination with a few others is like, it really, really helps me to take care of myself. And yeah, I can't see me having to rely on medications to manage these things, thankfully, ever again.
Yeah, no, I love that. And I love that you have these sort of practices that are kind of different spectrums of, I guess, stereotypical, but, journaling being this, quiet, soft tool, and the movement and the heavy metal, the opposite. And I think, especially as women, just having this, giving us, again, permission to be full spectrum in expressing and having these outlets to be all that we are. And I love what you said about entrepreneurship. I agree. It could be very lonely. And it's kind of this self-leadership that you don't ever get to take much of a break from unless you're, offline and intentionally doing so. So thank you so much for sharing all your wisdom. And I'd love if you can share with the audience, what's the best way to connect with you, and how you recommend doing that, or where to start on your website.
Yeah, so there's kind of three ways that you can connect with me. So I'm quite active on LinkedIn, so you can just find me, Dr. Aileen Alexander, on LinkedIn. I'm active also on Instagram, but it's a completely different feel, a completely different platform, and tend to post slightly different content there. And my handle is at Dr. Aileen, and it's DOCTOR, like the full word spelled out, because somebody else had DR Aileen. And then my website is doctoraileen.com, and you can find out a little bit more about what I do and the different programs and things that we offer there as well.
Perfect. And we'll share all those links in the show notes. You also have on your website your TED Talk, which I was watching earlier this morning. Very, very cool. Congratulations on that experience. Any sort of last little bits, a bit of wisdom you want to leave us with, or something, that you often tell your clients?
I think what I would like to leave or finish by saying is, like, for anybody who's on a journey to improve their health in any way, like, start small. I often use the analogy of a ladder. So we don't get on a ladder by trying to jump onto the fifth step. We take the first step, and then the second step, and then the third step. But for most people, the first step feels like seemingly insignificant. They want to do the diet and the exercise and the journaling and all this stuff. But that isn't realistic, and we're setting ourselves up to fail, which cultivates this mindset of, I failed and I can't do it. So I always say to people, set the bar really low, like so low that you can definitely jump over it every single day. And then you slowly look at raising it on a weekly basis. Because, we're going to be on this earth, hopefully, for quite some time. It takes time to build these habits up. I didn't do it overnight. The ladies that I support don't do it overnight. It takes time. And by doing it in this sustainable way, they're much more likely to be longer term and long lasting.
Brilliant analogy. I love that. Thank you. And we look forward to being in touch.
Thank you.
Hey there. One last thing I wanted to share with you If you're enjoying this podcast, it would mean so much to me if you could rate and review it on your favorite podcast platform. It really does help us grow the show, and this being so important to me to get this message out to more women to help them optimize their wellness and ultimately their lives. This is my mission, and I would greatly appreciate it if you could support the podcast by rating and reviewing. Thanks in advance. Have a good one.